But it's really nice to meet you all and thank you for sharing your time and your space with me today. So, as Lisa said, I am Managing Director of Advocacy with the ALS Association for the Midwest region. So there's a team of us, I think 9 of us across the country that work solely on state policy. And well, I would say we support federal policy also, but really being in the state legislatures and moving policy at that level of government is what we do. All right, not moving forward. Hmm. All right, maybe I have to do it this way. So my email address on here, same format as the rest of the staff. But if you have any questions outside of our chat today, please do not hesitate to reach out. So overall, beginning of what is advocacy at the association. So our work really is educating lawmakers at every level of government, mobilizing them to really understand our issues, and then plugging people like yourself in that have a real life experience, have been impacted by ALS and continue to be impacted, a voice at the government level so that we can move policy forward that's actually helpful for our community. And we do it in a nonpartisan manner. That's how all nonprofits organize themselves and have to operate, but it's also a benefit to the work we do in the conversations in a really odd political time. Our issue just hits everyone. It's across the board. So we don't have to have any of those. Well, there's still some conversations to be had, but I always think that we're lucky in that sense that ALS is not a party issue, it's an everyone issue. So when I talk about public policy, so really I'm a lobbyist and work with other contract lobbyists and coalitions for the ALS Association. And this is a short but still wordy list and still doesn't include all the things that we work on as far as policy in government. So just a quick look at what we're doing in the federal space, ALS appropriations, so money, making sure we have money in clinics, money for research, for care, for clinical trials, really any way that we can infuse the work around ALS and ALS care and treatment, we do that. Drug approval, access and affordability, making sure that once a drug is created and it has FDA approval that people can access and afford it, which is often half the battle, if not most of it. Increased support for home care and home modification, increased support for telehealth. And those things are really repeated in our state priorities too, but there we get to do some, I mean, I think because I work on state policy, some fun stuff. Um, so again, state funding for research and clinics and care services, and increase access to insurance coverage and ease of insurance access. So much of the work we do is trying to pass policies to remove barriers for prior authorization, and I'll talk about that in a bit. But really, we know how much of a mountain and hurdle the insurance process can be. So if we can get in the mix and make policies to help that, we do. And this next one I want to point out was specific to Wisconsin, and I was successful in working on this. Access to durable medical equipment and complex rehab technologies. So the power wheelchairs and different lifts and capabilities of the equipment in Minnesota, or sorry, not in Minnesota. I'm based in Minnesota. Forgive me. In Wisconsin, complex rehab technology needed a prior authorization just for a repair for a chair that you already had. That didn't make sense. We worked with the legislature, so now there isn't a necessity to have another assessment from a physician that already knows you need the chair and just needs to get a repair. We are trying to make sure that any money that is spent on getting prescriptions counts towards deductibles, because there's programs in policies that make that not happen. And that's also another thing in Wisconsin that we're working pretty hard on and moving into our third year of trying to pass, because we know it really impacts the people that we're working with. So when I say advocate, what am I talking about? Who is that? It really is anyone that cares about those issues, all those things that I said on the previous slide, and all the things that I didn't say too. Um, it's people who really are just sharing their stories, sharing their experiences, and taking that extra step farther when it comes to the legislature. So I don't know if any of you are familiar with action alerts, but an email that comes through that says contact your legislator about XYZ. Um, our group and people like me and the association send those out. So anyone can get those. That's a simple click. But there's also different things that people can do to advocate and be advocates with our group. Of course, people living with ALS, their caregivers, family members, the work that I do with elected officials can only go so far. Knowing government and policy is one thing, but my job really is to elevate your voice and stories because you live that every day. And I will say, as you can imagine, a lot of people ask a lot of things of elected officials. So they need that personal touch and that personal story to really make sense and understand what we are asking for and why it's important. So this is really what it is. When I say sign up to become an advocate, and I hope that you all will and would pass it along, this is that first step. And at the link here, and I can provide it again in any after notes, um, we just ask for your name, email, address, and phone number. If you don't want messages, that's fine. You can say that and you will never receive any on your phone. And then your address, the most important thing, so that we know who your elected official is, and then we can connect you with the right person. So once you sign up here, and you're interested in advocacy, from there, I like to think of advocacy as a menu, of how much you'd like to be engaged. If it is signing up for that and you click and send that letter to your elected official once a year, and that's as much as you want to engage on that, awesome, because you've still shared your voice and pushed a little farther with someone who can change policies. The text alerts, we don't use them often, but if something comes up and we have to have a quick mobilization for something, we may do that. Asking you to call your representative, use social media, send a letter, share your story. I think that, again, like I said, is probably one of the most important things. And we've got some pretty cool ways that we've allowed people to do that and try to make it as easy as possible. Um, Especially when it comes to funding and talking about our programming, the stories always end up sending a message that really I can't say in any sort of policy language or request. So this is the next part. If you are on our advocacy page, these are all the different actions you can take, and we really try to lay it out, participate in the action alerts, find your officials, share relationships with us. If you've talked to a legislator, let us know. We want to make it as easy as possible, understanding that a lot of people maybe don't want to interact with their elected officials or are intimidated by it, never have. So that's my job, is to find a way, if you're interested, to make that easy, accessible, and kind of turnkey. So then again, here I was talking about sharing your story, and we can share this as well, but this is just an area where you can record something. You could send in a picture and then just write about what your experience with ALS is, or with diagnosis, how it impacts your family, caregivers, any of the services or barriers that you faced. This all can be shared here. And then we have that saved in a repository. It's actually all on the website that's accessible to anyone looking at our association website. Which I think it's nice too, to just to see what other people have wanted to share and how that's been used. And then we also have materials. Again, trying to make this as easy as possible. These are some materials that we've used for our past Advocacy Day in August, which was where we really mobilize and get out to our congressional offices on the federal level. Because they're home from DC, they're really focusing on meeting with people in their congressional districts, and we like to get as many people in front of them as possible. And this is just an example of some of the materials that we would have so that people feel confident and can engage to any extent that they want around our policies. And then just pointing out this last one here, I just want to say again, if you are interested in advocacy or know someone who may be interested in it, we're by no means saying that you would need to walk into a meeting or make a call to an elected official knowing the ins and outs of a bill, insurance policy, background of committee stuff. All of that, we really try to make as easy as possible. Only the information you need, really, we want you to go in and explain your experience, say why it matters to you, and you can leave all of this, meaty policy stuff behind or connect them with me or another of my colleagues. Um, Again, just making it as easy as possible and highlighting your experience because that is the most important thing here. And then here's just an example when I was saying action alerts earlier of what that looks like. So if you saw an email from me or from our federal team and it says email so-and-so now. So this is actually one that was an action alert just before the holidays. And this bill has passed, which is amazing. And I like to think it's because so many people clicked and made sure their voices were heard. But what you see in front of you, you'd scroll down and you just press submit, and that's really all you got to do. These letters will go out to your elected officials, and they are impactful. I will say, I worked for Congress for 7 years before I moved over to nonprofit advocacy. And it was part of my job to go through and see these letters. And maybe someone isn't sitting there reading through every single word every time, but you do keep it count and you keep a tally. And if there's a day where I would get 15, 20, 30 emails on one specific issue, then that's something that I'm going to bring to the attention of the congressional member or senator. So this does have impact. I know over time people think, oh, sending an email is just going to get lost, but there are people looking and keeping tally, so this is a small action with pretty big impact. And then here, this is the exciting part. So these are some of the things that advocacy gets us. These are the things I would say almost all of these have been within the last year of what advocacy has done. So the first one here, this was that past action alert I showed you, the Elizabeth Dole Home Care Act. So before this was just passed, home care costs for VA for veterans was only covered up to 60%. And now that is covered up to 100% because of that act passing. It was signed by President Biden just in December. So this is a really exciting change that we pushed really hard for. That action alert went out. We had people testify. We had people on staff kind of digging in on that with almost 100% of their time. So it was a big change we fought for, and it really wouldn't be possible without the advocates that activate around the things that we do. Another one here was Medicare deciding to cover seat elevation. It wasn't something that they did prior, and that was a change that came out of our advocacy. Federal court striking down copay accumulator rule. Again, this one, it's a bit meaty, but I briefly explained it before, making sure that any discount program or coupon used to pay for a prescription counts towards the patient's deductible. Right now in Wisconsin, it doesn't, and it's something that we're working on pretty hard across the country. But if you use, from say Calsati, if they give you a coupon to pay for a prescription, that money doesn't have to go towards your deductible. And that's often a surprise for people, that that's in their insurance policy. So we're working on that to change it. Fingers crossed this session in Wisconsin. Forgive me, I know that's a big no-no. Forgive me. So hopefully this session we'll get that done here in Wisconsin, after a 3-year push, which would be a big win. And then here at the bottom, another one of our most recent wins, which one of our staff members worked extremely hard on to get Medicare to cover Qalsody, and not only moving forward, but to reach out to people who were denied previously to see if they can get them that medication at this time. And these things are, big things that really, when it comes down to it, is people activating, people sending messages, having meetings, testifying, and sharing how all of these different things impact their daily lives in really real ways.